Joining us here in studio is Johnny Crowder, the founder and CEO of a global mental health company, Cope Notes, and also one of this year's ICMA Gamechangers. Thanks for being here.
I am pumped to be here.
I'm excited to talk to you. So tell us, what is Cope Notes and where did you come up with the idea?
I grew up with a bunch of different mental health conditions, all sorts of symptoms that were all overlapping. So depression, anxiety, OCD, PTSD from abuse when I was younger, and I didn't know what to do about it, and I think my parents wanted to look the other way. So it's not like I was first in line for a therapy appointment. I did not want to look at it. I wanted to bury my head in the sand. And then once I did start treatment, I kept quitting because I didn't feel comfortable. I wasn't warmed up to the idea of using a mental health resource. So I went to school for psych and started focusing on building something that would be an easier first step. So if someone isn't quite ready for therapy, or maybe the need isn't there for medication, how can we serve people short of that with something that they can engage with? So I created Cope Notes about 5 years ago, and the short version is that we use daily text messages to improve mental and emotional health over time with these simple little interruptions. Just one text a day at a random time that includes health education information. And over time, your brain literally learns to think in healthier patterns.
Wow. So you've been doing this for 5 years.
Yes.
We've gone through, however you want to say it, a pandemic. So did you see a surge in people needing mental health services at that time?
Yes, so I definitely didn't plan to be here for that. I've been working in the mental health field for 11 years.
Okay.
So a lot of people say we're just in time, and I always say I was 11 years early.
Yeah.
But it did equip us to be available because our user base grew like 4 or 5-fold in a single year, and it was because the demand was through the roof and so many other providers couldn't scale, which is why I'm such a huge fan of digital supports, because digital supports can scale in a moment's notice, whereas physical supports have a much more difficult time with that.
Yeah, that's incredible that you were already doing the digital thing, and that's exactly what people needed at that time.
Yeah.
So the idea of community mental health is really picking up steam. So are we finally starting to realize that we are all in this together, and then discuss how you help people who maybe haven't gotten official diagnosis?
On the first side, I think people have known that everyone experiences components of mental health forever. Like, there's never been a person, to my knowledge, who has never felt depressed, who's never felt stressed, who's never felt anxious. If there is a unicorn out there like that, I want to meet them because I have questions for them.
Right.
So we've all kind of known underneath that we're all exposed to and vulnerable to a lot of those feelings. But I think only during and since COVID have people actually admitted to themselves what they already knew, which is that we're all human beings at the end of the day. And I think on the diagnosis front, the biggest, most misleading thing that I hear is I don't need to use a mental health resource because I don't live with a diagnosis. But we know that more than half of all mental health conditions go undiagnosed.
Wow,
so
more than half.
It's like, imagine saying like, I don't need to brush my teeth, I don't have cavities. It's like,
Never been to the dentist.
Yeah.
Wow, interesting. So what is the cultural impact of making mental health a cornerstone of the community?
So this cannot be overstated. There's a whole part of my talk that is focused on the cultural aspect because rules don't matter. It's only the rules that people think they should follow that matter.
Okay.
So, for example, earlier today, I don't want to get arrested for this, but I jaywalked earlier today.
Okay.
It's a rule that you shouldn't jaywalk, but
We're
I
in
didn't.
a walkable community.
I didn't perceive it as a big deal if I jaywalked. So, culturally speaking, that's what I mean when I say culture. It's not about the policies that you put in place. It's about how they're perceived.
Okay.
And when you walk the walk when it comes to mental health, you don't just say mental health is important, but you implement resources and you use the resources yourself as a leader. You lead by example. You're showing them, not telling them. And the cultural impact means that when people go home, city and county employees go home, residents go home, and even leaders go home, when they're by themselves, not around anybody else, they feel safe engaging with the mental health support because they've seen somebody else do it and they feel culturally safe engaging.
And can you share some success stories from your work with the government?
Yes, so this is the most exciting thing anybody ever asked me about because look at me, I never expected to work with government. So it's been a huge surprise to be able to serve these municipalities that we serve now. So I want to call out a couple that have been awesome partners. So one is Aspen, Colorado. They've been an incredible champion for mental health, especially in Colorado, where it's very seasonal. You have people coming in and out all the time. There's a lot of transient people traveling. And then Saline County in Kansas is like one of my all-time favorite counties we've ever worked with. They blew the horns, like they built out loud. And then here's what's really important from the cultural perspective that you mentioned. Not only did Saline County actually purchase Cope Note subscriptions and then distribute them in their community and see success from it, but they did it in a public way that set an example for other employers locally and other organizations locally to go, man, if our community is doing that work, if the county that we live in is prioritizing mental health, what about us as a nonprofit? What about us as a hospital? Like, we need to follow suit. So big shout out to Saline County for not just walking the walk, but walking the walk in a way that inspired other people to do the same.
Now, you are one of the ICMA Game Changers this year. So what does that mean to you?
On a real human level, it means that I'm about to speak on a big old stage in a gigantic room. But I think what's really refreshing to me as someone who grew up really convinced that my community government did not care about me. Like I grew up with multiple mental illnesses, multiple suicide attempts. I didn't think that oh, I'm sure my city manager is trying to learn about how they can support me. Like, no freaking way. I was a teenager. I was convinced that nobody cared. So when I see ICMA earmarking mental health as an opportunity to change the game, quote unquote, for me, that means tangible change in the lives of kids like me, in the communities that these people represent. So for me, it's not necessarily a win for Cope Notes. It's a win for the greater mental health movement as a whole. So that's why I'm so pumped to be on that stage, because I'm not representing me or my story or my company. I'm representing millions upon millions of Americans who need the support of their city and county managers to feel better tomorrow.
And I'm sure they really appreciate that support and that representation. Johnny Crowder, thank you so much for being here with us today.
Absolutely. Thanks for having me.